what was your reaction? What was going through your mind from your perspective?
Thank you very much for inviting me to this wonderful panel, and thank you so much, actors, for bringing those stories to life. They're extraordinary. And I think where I would begin is coming back to the proposition that you opened this performance with, Christopher, which is, what does theater have to do with health? How does performance relate to healing? And I suppose I just want to start with three impressions of what that relationship is. One is that the scenes that were portrayed here, especially the way that they were portrayed in these bursts, these sort of really strong images that burst into life and then close off, have left an impression with me. And I don't know about you, but I often don't remember the lengthy reports that I'll read about, whatever health concern I'm researching at the time, in the same way that I will remember that birth scene, for example. That was a very memorable birth scene. So it's left an impression with me, an emotional impression. The other is that it puts a human face to a complex issue. It makes it accessible by bringing us into a human story with specific characters at a specific time. And maybe the last thing I'll say for now is that it allows us as an audience, and it allowed me as an audience, to have a private contemplation, but in a public space. And there's a paradox in that. I'm having a private contemplation about an issue that I think about or don't think about, and yet I'm doing it with others. So a few impressions to begin with. Thank you so much. Pass this down.
Thank you. I'm honored to be here. Thank you for inviting me to this panel. Something that maybe you should know about me is I am a nurse. And so, well, thank you. And my role is educating nurses, nurse practitioners and registered nurses, and like my colleague here, the personal that is really the impact, right, that happens with this. I thought it made me think about patients and people and my own experiences as a nurse that I have interacted with and who have often faced in our, as they call first world culture, these issues about paying for medication. What am I going to pay my rent? Am I going to pay for my medication? Here you're telling me, here's all these wonderful things I can do to promote my health, but I can't afford them. They're not accessible to me. They're accessible maybe to you, but they're not accessible to me. And it's something that I think lives out every day for not only the people, but also for the practitioners and the people that are engaged in this healthcare system that is at times absolutely crazy, right? In what we tell people they should be able to achieve without any resources to actually achieve them, right? And so it was a very personal experience for me as well, and I want to thank the actors and the people for bringing this forward.
Okay, thank you very much. So on this play, I think that there are two different stories. One is more essential health services, how the people need to access to their services, and then the second part is more financial aspect, which is a key component of the universal coverage. So I'm very impressed, and thank you for all the actors to explain this concept of universal coverage, which means the access to essential health services with financial protection it's such a way to easy for the general public to understand this concept, because I'm also a medical doctor and also health economist. I find it very difficult to explain this concept to the general public, and also how to convince the people to promote this direction to access to health services with the financial protection. And particularly the later part of the show explain why the pooling of the fund is important for people, and also how we convince the people to agree this this approach to pooling the funding from the different income level, and even to convince the people why we need to pay for the money for the patients because we are not sick. And there are different ways to understand, because people might be sick in the future, or a family are sick, or this is a social solidarity or human rights. And there are different ways to understand the concept and then pushing this agenda. But it's very simple approach to explain this direction. And as you know, in the next week, there's a higher meeting on UHC, and we are expecting the head of states and minister coming. I think this show is very good way to convince the head of states to push this direction. Yeah, thank you very much.
Hello, everybody. I am Isabelle Wachsmuth, and I am very touched by what you performed tonight, because I think it's very important, because that touch what is universal to us. It is about what is common, and what is common to every human being. It is the emotion we have, and this solidarity process between each other. What is absolutely key to achieve universal health coverage. And it's very well portrayed. I love it because you portray the worst condition, work condition when it is extreme, and what does it mean? And as well in the more, you think more accessible way, with the second part, with the accessibility to the doctor, but in fact it's too expensive, Donc it's very well done, to portray the two aspects together, and that show at the end it's the same issue, because you can die, and that demonstrate we are interdependent, and when something happened to you, that happened to the other, and we are one humanity, one health for all. And I think we need to come back to that, to our solidarity, between each other. And for me, that it is a message, and it's very important to portray that under theater format. I believe in that because it's much more powerful, and that touch really the heart of the problem, more than the long speech, or with just norms and standards. That touch really the heart of the people, and they can uptake, the message and do something like you have portrayed. It's about solidarity, it's about humanity, and that need to be the message all the time to what we are doing. Thank you so much for the performance tonight.
So I'm the writer of the second piece. I can't give a professional reaction because I'm not a health professional, but what I can say, first of all, is to thank Christopher and all of the actors and the artists involved with the production. So thank you so much for the wonderful work that you did. It was, and of the first piece as well, it was very moving. I'm very grateful. The only thing that I would add is just to say as a point of interest. So Christopher's been helping me to develop this play over, I guess, about 2 years now. And so there's been a couple of drafts of it. There was a draft I just wrote sort of by myself as kind of just a know-nothing playwright who doesn't know any of the things that these folks do. And in the course of, I guess, of performing it in a couple of venues, Christopher would get back to me and say, hey, I'd like to ask you for this rewrite on this. And like playwrights are asked for rewrites or like for a bunch of different reasons. And usually it's like with dramaturgical development of some kind, the character development of this person, or could we do this play with 5 actors instead of 6 and save a salary or whatever. But in this case, it was, could we, he would say, would you consider a rewrite based on something that I'm learning about this circumstance, about like, when I act, he said, when I take this play out, I develop it with World Health professionals. For example, one that he asked me for was, he said, could you include something in there about the fact that in the very first draft, the doctor was sort of just like the person at the top of the power pyramid in this small town. He said, could you rewrite it a little bit to have the doctor be sort of in the middle as a cog? The doctor is also someone who is suffering from that a lot of funding has been cut off from some sort of central funding source, and the doctor is inside sort of the same crucible of pressure as everybody else. Then more recently, I think for this draft, Christopher reached out to me and said, could you make sure that that climate change is incorporated as a referred to element of this? He said, because he said people think of climate change as like a separate issue from world health, but that's not how that's how I thought. I thought, those two big serious issues, but that they were separate. But that's totally wrong. They're actually completely interlaced with each other in a lot of ways. And he was like, could you incorporate that into the script? And so it was sort of a unique privilege as a writer to do rewrites based on sort of like on the ground input from really informed professionals as a way making the drama better in a way that I'd never that I'd never done before. It was a real pleasure and an honor to get to work that way.
Well, I don't.
You have a mic.
Yeah, I've got it built in. I was born this way. Well, I'm not going to comment because I was just too involved in the whole thing. But what I would like to do is open it out to the audience, and you can ask questions of the panel, of the cast, or just share your own stories and experience, whatever you'd like. The only thing that I would ask, and the ushers will run around with microphones, is that somebody else actually point to people because I can't see them. So maybe, would you like to be the sort of facilitator of the conversation? Yeah, Rhonda? Yeah, okay, great. And I also just want to acknowledge another great talent in this room, and that's Hope Garland, my co-director. And just as a personal testimonial, a few years ago, I was suffering from stage 3 cancer and was given a 50% chance of surviving the year. Spoiler alert, I lived. But Hope gave me an opportunity to work with these actors as part of the American Academy of Dramatic Arts alumni show. And that process, I believe, was a fundamental part of my healing. And I want to thank her and the other actors for... I won't go so far as to attribute healing powers to theater. Yeah, I'm at WHO. But I will go so far as to say that the theatrical experience gave me an optimism and a centeredness that allowed the healing to happen. So maybe if someone in the audience cares to ask a question or make a comment.
Someone here in the center. She's bringing the microphone.
Hi, I'm Anna. I just want to thank you for the performance. It was really insightful, and I was delighted to increase my understanding of what health means and, as you said, climate change related issues. And it has definitely left a very, very deep mark on me. The question I would like to ask, and it's not addressed at anyone in particular, but is usually you have the idea that developing countries lack health facilities and that developed countries have a lot of health facilities. I found it incredibly interesting how you turned that around. So I would like to understand whether there was any thought behind that. Thank you.
Of the authors or the...
Oh, did you... Oh, yeah.
She said the authors.
Yeah.
Okay.
It might be a question to you.
In terms of like, I mean, like, in this particular, in terms of like, the pot, I'm only speaking for the second play. I mean, a big thing with that was I wanted to make it as I wanted to go against my usual instincts in writing a play where I'll pick up like a very specific the play will very specifically be set in a certain city, certain state, whatever, and like have a lot of the details of that location or whatever. In this case, I wanted it to be sort of as like archetypal as possible, so there's sort of a sense that it could be happening, you know, and I even wrote it in such a way that like I wrote the script such that actors of any gender could play any of the characters. So I wanted it to be really as general as possible, but I wanted it to hit the idea. And you know, others should. I'm kind of a know-nothing playwright, and these folks can speak more clearly. But I very much wanted it in the context of. You know, of the one I wrote, The Pot, that it could be happening just about anywhere, like developing country or maybe a more rural part of the United States, say. But I wanted very much the idea that the resources existed but weren't being shared equitably. I didn't want it to be that the resources just weren't there at all. The serum that nobody had the serum, that it very much was an access issue. And that once the people in the story had gotten to a point where they had gotten past the various kinds of conditioning that made them turn against one another. And I wanted to have like a lot of the kinds of things that I notice are used to turn people against each other, like an over worship of the idea of like a work ethic. Like if you're struggling financially, that just means you should work more. And so people who do that will think less of people who don't do that or can't do that or whatever. But once those various divisions are removed and once all those people are unified and have banded together to find a way to survive in the unfair situation, once they're unified in that way, all of a sudden they're like, okay, now that we found a way to survive in this unfair situation, why is this unfair situation existing at all? But you can't ask yourself that question. You can't get to a place of asking yourself that question until you've gotten past the survival stage. And then you feel strong enough to kind of look around and go, actually, why is any of this going on? But that's how I don't know if that touches specifically on your question, but that's how I wanted to address it in that play. It's in terms of the other play. Should I pass it off to anybody else?
Well, I'd like to address the question in terms of the real world, not just the plays. It is true, I suppose, that where there is wealth, you have the ability to have more hospitals, more expensive hospitals, more advanced treatment, I suppose. But it'll be interesting for all of you to have a look at the UHC indicator report that's coming out tomorrow and just see what is the correlation between gross national product and progress towards universal health coverage. Is wealth a direct factor or not? I do know from my personal experience, having worked a bit in Sri Lanka, I wouldn't call that a wealthy country, but they've achieved universal health coverage. You don't have to be wealthy to do it. And I imagine somewhere in the world there might be wealthy donor countries that I was born in that might not have universal health coverage. I think by playing with that a little bit, it gets to a fundamental truth that it's a little bit more complex than whether or not a wealthy country automatically has better health than a poorer country. I spent most of my WHO career in the beginning working on health information systems in HIV clinics in Africa. And I can tell you from my personal experience that it may well be that many of the toughest health problems are in Africa and in developing countries, but what is less known is that the solutions are there too.
So I just wanted to comment on, it's just a brilliant point that's been made. You know, many of years ago, I was working in North Philadelphia, and I will tell you the newborn mortality rates in that area were comparable to those in developing countries. I mean, they were terrible. And so again, it makes the point that just because you are considered a developed country does not mean that there are not many pockets within that country in which health outcomes are deplorable for the people that live in certain areas and certain neighborhoods.
Another question?
Oh, let me see.
Hello, my name is Stephen, and the question I have, or what I saw depicted there in the play, was where the mill was standing up against the healthcare, or the pot being collected. And I wanted to basically see how that plays in, that the employer basically standing up against any type of the workers putting themselves together, how that actually plays out in real life in the healthcare industry, of how the employers may act as a type of barrier to sufficient healthcare to the workers.
Maybe that's a UHC 2030 question.
Yeah, of course, there are different schemes. So it's typical, the scheme that we have is a social health insurance scheme or employment-based insurance that the people associate with the contribution with the employers. That is the major part of the contribution in the especially developed country or middle-income countries, but also many low-income countries, or the country that they are still rely on the more informal worker, for example, the farmer, agricultures. They don't have any kind of formal system to the employee to contribute on this. So I think this is a different way to contribute on the funding. And then also the maturity of the society, there are different transformation to how to contribute the money, either coming from tax, or is it coming from the insurance contribution, or is it coming from, it's more like the subsidies from different products. There are different way, but I think it's very difficult to explain on different way. But yeah, what was your initial the idea on this, the contribution from the different
Or was it more of a metaphor?
I guess this is more community-based insurance scheme, right? That is a more small community, that all people belong to the community contributing the funding for the community of the whole.
Yeah, and the other issue, and you have portrayed very well, it's about, sometimes, as you know, overdiagnosis. Donc we need to address as well this issue. It's one aspect about the repartition, the redistribution, of resource. But if the price continue to be more and more high, and the income don't change, in the society, it's not sustainable, it's not affordable. So it's about more the global financial scheme need to be reviewed, It's not just a redistribution process, you know what I mean? Donc what type of quality, it's not just about the access, but it's about the quality of care, and it's about, if this, the diagnosis, is right, is not over-diagnosis, for example, specifically for people who can pay, and that it is additional elements, in the equation for me, and we face that. For example, for cancer, I know, one dose, it is 30,000, for example, US dollar in Switzerland, donc if you have no, the full assurance, you cannot access to the treatment, for example, Other
questions? Here?
Hello, that was wonderful. Thank you, both of the shows. I thought the end of the second show, when they were coming and they were saying they, who is they? I thought that was a very evocative question. And as somebody, I work with, it's an organization called American Promise. We're trying to pass a constitutional amendment to get money out of politics. And I think that they question to the pharmaceutical companies, to the insurance companies, to the hospital magnates, like, how do we in the US, in this, how do we get past the legalized bribery that allows them to kind of make it as it is? What are your ideas on that?
Well, I don't think I have an answer for that, actually. But I suppose the way that I want to respond to that, speaking as a drama therapist, is to come back to the theater and to pose that, because what that play did was ask us to contemplate the question and get curious about it and get interested about it, and it prompted your question. And if we were to move to a different style of theater, something more interactive, for example, like forum theater, we might actually pose that question and invite different possibilities to come from the audience. How do we grapple with this scenario? And if we could find the they, as Michael Moore has often tried to do in his films, and knock on their door, what would we say? And would it just be one of us, or would it really require a collective strategy? And then what would that collective strategy be? So I tend to seek out those kinds of responses on the stage, whether it be in a private room or in a venue like this, but open it up to the rest of my colleagues here to respond as well.
Well, I think as an artist, the artist side of me says our job is to ask the question, not to provide the answer. So, I think from a WHO point of view, the whole purpose of having UN technical agencies with authoritative information, a mandate to gather research on what are effective approaches, how to bring different groups together to have a constructive conversation. I think, first of all, a culture of open scientific honesty, where the facts are on the table and openly debated and revealed, and I think sometimes in today's culture that's not as easy as it used to be. But to engage publicly, to tell the stories, and that's where the intersection with theater comes in, to start that conversation. With universal health coverage in particular, WHO does not have a single recipe for a member state. What we're trying to do is show what are the evidence of what works and what doesn't, but what each country then evolves in its own society is going to be what's right for them. We can compare the way pharmaceutical companies operate in one country as opposed to another and see what's effective, what actually influences the quality of the medicines, the price of the medicines, and have an open conversation about that, and even to a certain degree, I think perhaps make policy recommendations on what are effective ways of regulating or not regulating, so that in the end people can afford the medications. One of the things that I'm most proud of that WHO did during the HIV epidemic was pushing hard for generic versions of drugs to bring the price down so that we could save entire populations that were at risk because the drugs are too expensive. So that there are ways of going about it, and things that, strategies that WHO has advocated in the past. So there are ways.
There's one here.
Hello, I'm here to ask opinions about education in healthcare earlier than later, because this is a room full of adults and a few, I think maybe minors, but not super young. And as far as social marketing goes, sort of playing to the emotions of people with the different plays that were presented. There's been suffering going on for a very long time, and I question whether or not showing, suffering is what needs to happen, because it happens every day and everyone knows it. So I just wonder about your opinions, again, on putting health as a priority in front of people younger and younger, could be a way to introduce the communal pot to people as opposed to waiting until they're so old. So, no offense. I mean, when it's almost too late. And I say
Old dogs and new tricks, right?
Well, I'm just wondering because, I hope that this is a room that is, diverse, that has people who are involved in healthcare and understand it, and then some people who are just new and curious, because those are the people that I think you're trying to reach. I'm actually one of the people that's part of the choir that you're preaching to, because I'm both a patient, 6 heart surgeries, but I also work in peri-op and the OR at University of Penn Level 1 Trauma Center. So, I'm hoping that there are ways to reach people that, when you're talking about social marketing, you don't have to tug an emotion. And what I'm seeing is that the earlier you're able to introduce these topics to people, almost, the more they become used to understanding that, helping the community is the way to go. So what are your thoughts on the earlier education?
So I thought it was it's just a really, really great question. And I think it was very interesting when you said that everyone knows that there is suffering, everybody sees it. And I guess what struck me about that was, but do they? Do people who are healthy and are out living their lives really recognize and understand what is happening to others around them in terms of their own suffering? And I say that because sometimes even with our own families, sometimes we don't know the choices that are being made and the decisions that they are being made, because people don't want to talk about it. People are sometimes ashamed to talk about it, that, I don't have enough money, or I can't do that, or, I'm making choices that maybe put me in a different situation that I would like to be in, but I'm not necessarily going to share that. And from a healthcare perspective, one of the things that I know when you talk about education that we teach and we teach and we teach is about understanding and hearing patients and people's stories and engaged in advocacy. Advocacy around those issues is just so important, because as healthcare providers, and that's the perspective that I'm speaking from, we do see it. You do see it. Right? You see the trauma, you see the worries about how are we going to pay for that? What is that going to cost? That specialist or no specialist, right? What is the cost of all of that? And so where is the voice of the healthcare providers out there advocating for change and telling the bedside stories of our patients from the perspective from which we see it, right? I mean, there's a cost to be a healthcare provider. There's pain there, right? There's pain in seeing things that you can't fix for people and you can't intervene. But what we're trying to say, at least I know here at PACE, and I know many of our other educators, is your job is not only to provide that direct care, but to advocate locally, regionally, statewide. Move your voice forward, because your voice has power to help change what's happening.
Thank you. I'm just nodding, listening to you. Thank you. I do want to respond just briefly to say that I agree that these ideas need to be seeded earlier. especially the notion of the pot. And I will speak as a Canadian, having moved here 10 years ago, and understanding very quickly that conversations about socialism really quickly turned into conversations about communism, and something to be, feared and run away from. And I don't want to romanticize Canada, but I will just a tiny bit. Which is just to say that I grew up with stories, or the acceptance and the understanding that our healthcare would be provided for. And we do have a two-tier system there. It is quickly changing in that country as well. But I didn't worry about it as a child. And we did hear the history of how that happened. It was a story that was told in our history classes about how that fight was won and why it mattered. And so the notion of the pot and the simplicity of that image is something that I think needs to be shared earlier. And I think it's really important for us to grapple with it in this room with this group of adults as well, because I could really identify with the characters that you included in that second play, especially your character, I actually don't remember if you had a name in the play, but the character who's holding the voice of, I don't know if I should do this, because I think that we struggle with an internalized, we've internalized a certain level of fear around collective movement around this issue. And so that's the piece that I think that we very much are struggling with here as adults in this room. So we know the suffering, but then what are we going to do about it? What is it going to take? Are we willing to make that effort?
Something that occurs to me with regard to your question is, it's interesting, the pot could almost be, maybe not quite, but it could almost be. I did a lot of children's theater when I was young, and that was sort of like I did children's theater both when I was in elementary school and then later when I was in middle and high school, and it was and that was something that I was really into, and it had a big effect on sort of my earliest impressions of things. It was definitely an educational tool for me. The pot could almost, aside from its disturbing themes, it could almost be a piece of children's theater because it's very simple, archetypal. There's no curse words, no sex, no violence. You almost could, other than the, it's possible that people read it and say this is a little too disturbing for children to be, but one thing that your question makes me think in terms of like early education is that, like I said, I did a lot of theater when I was young, and particularly when I was in high school. I was involved in a lot of what you might call issue plays about issues facing teenagers, and the issues that those plays focused on, it's not that they were the issues, they definitely were. They were usually very individualized things like eating disorders, or suicide, or like or peer pressure, or they were like don't do drugs type plays or whatever. And those are all important things. But what occurs to me now, just listening to your question and listening to some of the stuff that the folks on the panel are talking about, is we kind of never did plays that questioned the power structure that we worked in. We kind of never did plays that speculated on why we were in the school system we were, why we had access to the resources we did, why people teens who might be having mental health problems, like it wasn't just like the message of those places is always seek help, seek a counselor, but did everybody have equal access to counseling services? We never did plays that asked those kinds of questions, that asked if we were being treated appropriately in the structure that we were operating within. And maybe there just need to be a lot more. I'm just saying plays because that's the only thing I know. Other people have other better ideas, but maybe there need to be a lot more educational plays for young people and for teenagers that aren't just about highly individualized, siloed off subjects, but are more questioning about structure.
There's a question here in the striped shirt.
This is truly amazing. I was invited by my colleague through LEAP. It's a creative after-school program, Hope. She can't see me here, but she's looking. Yes. Hi. But I've been inspired. I'm an educator now. I work full-time during the day through the Department of Education, teach after school through the creative arts. But I consider myself, from a young child, music is running my family, and it's been therapeutic. We come from a very loving, but we have some dysfunctions, but music has always been our key to just bring the wholeness and healing. Coming from working in recreational therapy, I've seen the great benefits of healing through the arts. I wanted to also talk to some of our actors, and I've seen a little bit of your resume, and also from our therapists, because I've been inspired and moved. Prior to coming into LEAP, I started my own nonprofit. It's called Working Arts to Accomplish Your Unlimited Potential. And I've been inspired. I'm a mother of 4. My daughter is here with me tonight. She's 15. And working with young people, I see a lot of the emotional and social challenges that was brought up. And I also, prior to, I'm not going to be that long, I used to teach in early child care as well, and when daycare before working in public school. But there is a lot of our young people who are depressed, dealing with depression, mental struggles, and of course the number of suicide is growing with young people, and I feel a need to address issues and use my voice and creative as an actress, singer, to transition into a recreational therapy. I can call myself an artivist, using art through healing and activism and giving children a voice. I would like to know how someone like myself, and also speak to some of the artists how we can make that connection through medical, because I feel that I need to use this vehicle to be a more stronger part and give more artists a vehicle to be of healing, other than just going into the doctor's office and, like you said, not having the resources to be able to afford, and people aren't seeing medical professionals that are dealing with mental illness or various mental conditions as depression and oppression as well. So I'd just like to hear a little more of, some of you have been experienced using arts as a vehicle of healing and therapy.
Well, we actually have a drama therapist who got certified today. So I think yesterday he would not have been qualified to answer that question, but today he is. So, Adam?
Thank you. And thank you for your brilliant, beautiful question. Thank you for asking it. When you were speaking, it brought up so much in me, right? And one of the things that I'm really thinking about is building community. How do we build community for those in need? How do we build community for those in need, right? And something you said earlier, Chris, I'm just going to ask the question, how is art healing? How is theater healing, right? And how do we build community using art, using theater? So one of the lines that I said in the show as my character, the father and the doctor, is, we are not alone. And I think most importantly, showing up for individuals who are in need is essential, it's vital, it's fundamental, isn't it? And when we do that, we show that we care. We show that there's love in the room. And I think that's very important. You don't need a fancy degree or any kind of license to do this. What you need is to show up. Show that you care. And you spoke so beautifully about the gifts that you enjoy. You're an actress. You're a singer. There's music. So offering your gifts in a way that can inspire, in a way that can help people to express who they are on the inside and bring that out, in a way that fosters connection and community. Those are some of the things I'm thinking about. And there's so much more. And I think that's why this is important that we're here today. To ask questions, to have conversations in this space, and then take those questions, take these conversations and bring them out of this space and continue on. So we're not just preaching to the choir, we're talking to a little bit of everybody. And maybe that's how it works a little bit. Did that answer just a little bit of your question? All right. Thank you.
Yeah. Oh, is it all right if I say something?
Yeah, please, please.
There's another question. I feel like your question and her question really tied together. I am not a drama therapist, but I do applied theater, which is theater for social justice and educational development. I work in schools. I do devised theater, creating original theater with young people. And for me, it always comes back to story. And story is what unifies us. And I really wanted to speak to your question because you asked about the emotion. When I was doing research for this character, do you know I could barely find a story about a woman who birthed in a conflict zone? It's all numbers. It's numbers, it's statistics. And maybe a line here or there, but barely anything. And I went, wow, like where are the stories? And it made me afraid, like that we're gonna get that we are getting or are desensitized, and that's why women aren't getting the proper health care that they need in this country or in other countries, whether it be a conflict zone or anywhere else, especially women of color in this country. So, you know, I personally don't do healing. My work can be healing, but if you're thinking about social justice and young people, I work with as young as kindergarten doing social justice theater. Ask them their stories. Ask their opinions. Ask them to create. They care, they know more than you think, and they can do this work.
So I'm sensing some in the audience are getting a little restless. Perhaps we can continue this conversation in the lobby with some drinks. I invite you all to join us there. But I would like to end with a quote that's very much related to what has been emerging from all of the conversations here. And it's actually a quote. It's one of my favorite ones. It's from Carl Jung, the great Swiss psychologist, who once said, "Loneliness is not the absence of people. Loneliness is the inability to express what matters to you most." And I think particularly when we talk about our youth, the inability to express what is authentic to them is the source of many of our discontents today. You know, so giving that voice, creating plays that are not just didactic, but involve the audience, where we see an ownership there. It's something that Isabelle and I talked about today in terms of working in Ebola response in the Democratic Republic of Congo. How do they own their own story and create community through the act of communal storytelling? And theater is just one way of doing it. There are others as well. But on that note, why don't we go to the lobby and commune with some shared stories?